Hey guys, welcome back to the channel Techado. And yesterday's episode, we had discussed about the history behind this virus and the way it was spreading. And we also talked about, we did emphasize about two key factors, which was diabetes and hypertension, which is comorbid diseases. And we also talked about virus to human efficiency. These three key factors is a very important terms when it comes to knowledge about this virus. In this channel, I am not going to take a substitute of your physician or anything. I am going to pour you with knowledge that you might require to know to understand this virus way more better than anybody else. In that way, it will empower you, it will empower your vision about this virus. Now, there is something that you need to know so that we do not panic, or we also take necessary steps because it's key importance. Now, a lot of us, like a lot of, like over the world, like a lot of clinicians, they're like, why are we panicking? There is nothing to panic. Today, we are going to discuss about three key factors. The first being ACE inhibitors or angiotensin converting enzyme, its role with coronavirus or the COVID-19 spread, and its role with SARS CoV1, which happened like few years before. Clear up your mind. Do not think about anything else. If you want to know about this topic, it's of prime importance that you understand this very carefully. So here is a presentation of a small chart that I have drawn. Now, I do not have not a lot of knowledge how to do After Effects or anything, so I do not know animation. I will show you in a way that I have always done presentations in the channel, that is by screen recording on my iPad. And I'm going to show you what this ACE is all about. So watch this.
Okay, so the best way to talk about this is to show you through the chart. At first, we're going to talk about kidney. Okay, so remember this, the kidney has a hormone called renin. Okay, so whenever there is a decrease in renal perfusion, you do not need to know what renal perfusion is, but remember this, water and salt. Whenever that sort of stuff drops in the kidney, what it does is that it sends a signal. And from the liver is where angiotensinogen is released. Now, this renin goes out here. It converts this angiotensinogen to angiotensin 1. And from that angiotensin 1, when it comes to the bloodstreams, it gets the lungs, and both the lungs and the kidney releases something which is called ACE or angiotensin converting enzyme. Now, this is very important because this allows the conversion of angiotensin 1 to angiotensin 2. This is very, very important that this conversion happens, and this actually enables a lot of stuff. It stimulates sympathetic activity, and it also stimulates like sodium chloride reabsorption, potassium, and water retention. Also goes to the kidney, arterial vasoconstriction, and all that stuff. We are not going to talk about that. You do not need to know all that stuff. All you need to understand is that the entry point of this virus is more on this area. Hold on a second here. More on this area. So it is affecting the ACE2. And here is everything getting more, like confusing, because that is one of our major ways of treating a lot of patients that are suffering from, like hypertension, and these are in hypertension. These are first line drugs. AC inhibitors are our first, these are like literally our first line drugs.
Alrighty, so I hope you guys understood the importance of angiotensin converting enzyme. Now, there is one thing that we are forgetting, and I think right now even the world is talking about it, is that we talked about the spread of the virus through airways, and being airborne, and spreading from people to people through sneezing and coughing. Remember this, that ACE2 or angiotensin converting enzyme 2, though they are very similar and does the same function of converting an angiotensin to tensinogen to angiotensin, or conversion of 1 to 2, The factor that we forgot is that they not only live in our lungs or they not only live in our kidneys, they also do reside in a very small quantity in our intestine. So here comes a very big picture of one step that might have been forgotten by Chinese officials was that what about fecal-oral distribution of the virus? And we all know about hygiene in third world countries. And what about if people were not taking that necessary measure of washing their hands properly? And hence comes a very big issue of how to properly wash your hands. In next video, we are going to talk about, and I'm going to show you the most proper way to use Lysol and the most proper way to correctly clean your hands and the methods that we use before we prep for any sort of surgery, we prep for any sort of procedure. And these are the steps that we take. We go through this training every single time, and we are making sure, I'm going to make sure that you are following the same steps if you are living in a zone which is under quarantine or which is under supervision. Then you'll be asking, Das, what is this correlation? Well, the virus's entry point is angiotensin converting enzyme 2. So, from reaching lungs to alveolus, it will reach an effect as angiotensin converting enzyme 2. And that has been done in the SARS coronavirus 1, that has been done in SARS coronavirus 2. There is a very big correlation, and this is why we need to go back in time and try to understand what happened with SARS coronavirus 1. The same thing is happening. It is very correlated. But so understanding this, you might be saying that, thus, how about maybe decreasing the levels of ACE2 in the cells, we might stop the virus. But no, because if you decrease the ACE2 in the cells, the lung will be more prone to any sort of viral injury, because the angiotensin converting enzyme 2 actually gives a protection for your lungs. In layman's term, like it will protect your lungs, and it has been proven over the years that there is a protective function of this ACE2 from any sort of viruses in your lungs. And hence come the biggest, it might be remarkable that to understand this, but this is also very irony, because it is the way that we protect our own body. If we stop ACE inhibitors, or if we use ACE inhibitors, or like stop them, like literally like, and go for AR1 blockers, which again gets confusing, that if we stop that, the potential of people dying more from heart failure increases. So theoretically, we are learning that this is happening, but we cannot stop it, because in that way, our chances of causing more death becomes like twofold or threefold. And hence, this virus is a very, very important virus to understand, and hence it's more chaotic. And you might not, as a simple person, you will not notice the difference, but the amount of chaos that is present in scientific community is going to startle you, it's going to shock you, because it's like a catch-22 situation, like in a layman's term. The proteins that interact with your ACE2 lowers down your ACE2, increases the probability of lung injury by decreasing the potential of ACE2. Again, very contradictory, very, very confusing, and even I am not understanding this, that if we can decrease ACE2 and cut off the interaction of the virus to ACE2, this might prevent, but then ACE2 protects against lung. So how about we go for something else? Again, rolling back to the chart, if we block the receptors, that might be interesting, right? Because if we block the angiotensin receptor 1 by giving like telmisartan, losartans, these are the drugs that are probably used a lot. And like this might help in curing COVID-19. But it needs to be tested by mining, by going through like a lot of clinical records. And this is just a theory. And because if we do use more AR1B like our angiotensin receptor 1 blockers might help cure coronavirus disease, but hey, I'm not doing any clinical trials. It depends upon people, those who are doing this study, to understand that. And I'm 100% sure there are a lot of people who is doing more in-depth like study about this, and there are something going on to understand this spread. Now, I've talked about the angiotensin converting enzyme 2. You guys have a more or less good picture of what's going on. A very important factor, which we usually forget in immunity also, is vitamin D. And vitamin D's natural source is again sunlight, not any sunlight, morning and evening, especially evening sunlight round about just before sunset, and around about when the sun is near closing to the horizon. That is the maximum time that you're going to get vitamin D. It increases the expression of angiotensin converting enzyme 2 in cells, and that will help prevent this virus's expression in your lungs. Now, we talked about everything else, the whole lung route, the way the coronavirus is spreading. We totally forgot about the enteric route or intestinal route. I would really urge everybody to start thinking about this, that every virus or bacteria has got multiple routes. Start logically thinking about this. What are the open routes that is available? Your eyes, your nose, your mouth, and that's how it's going to enter, and your fingers. Fingers, why? Because you can put your hands inside your ears, your mouth, your nose, or your eyes, or everything. Utilization of mask. Utilization of mask is one of the prime important thing, but not any sort of mask, N95, and you are not touching your face, adjusting your face when you're using N95, but masks needs to be discarded after a single use, and we are running short of mask. So what can we do? Back in the days when we were in SARS, SARS coronavirus 1 as an ER, we ran out of mask because, like, in government setups also we were out of mask, to be very honest. I could not tell at that time because I was working with the government. And what we did was that our head of the department had shared this, that why don't we wear one mask normally, the other one we'll just revert it, go upside down and wear it on top of it. So in that way, what we are getting is that we are preventing germs from outside environment inside, and we are also preventing from inside environment to outside. Well, this is totally non-scientific, but it proved effective for us at that time. After understanding this episode is that cleaning of your hands is prime importance, covering your mouth is very important, but not as important as touching your with the help of your fingers, your mouth all the time. I think that, and the third thing is the fecal-oral distribution of the virus, and nobody talked about it. This is where a lot of Chinese authorities went wrong, Chinese health officials went wrong, because there is an article which I was studying, and I had this question like a long time back, that why are we not talking fecal-oral route? Why are we only talking about droplet infection? Droplet infection can be averted, but what about fecal-oral? So that is the thing we need to think about, and I think that's all for this episode. In next episode, we are going to show you the proper ways of cleaning your hands and everything. Angiotensin converting enzyme 2 is of prime importance, and I think a lot of health officials, those who are from different countries, should concentrate and do more clinical trials on this. And today you understood why this virus is so tricky to solve. Diabetes and hypertension sits on the top of like our disease chart, because if you do, in a recent survey in UK, they found that every one person in every household suffers from hypertension. So one person in every household suffers from hypertension. Imagine how much this world suffers from. More ways, and together we will understand this virus better. Okay, so till then, take care, have a nice day.